lacrosse ball. One of the things that I do like about the lacrosse ball is that it's inexpensive, $5, and it's an entry point for people to take an interest in self-maintenance and in looking after their body, and just kind of exploring a little bit about anatomy and yeah, just going after some of those areas that are showing a bit of dysfunction. But there's a lot that it can't do, and it's a $5 investment. It's not going to replace a skilled therapist. It's not going to replace a skilled set of hands. It's not going to replace clinical experience. And there's a lot that it can't do. It can't diagnose a problem and tell you what's wrong. It can't get chronic issues better, and certainly can't stop things from happening again if it's a patterning thing or a behavioral thing or whatever the case may be. This has a lot of limitations, and it can actually be used in a bad way as well. One of the things that I wanted to talk about today is something that I've seen that can cause the lacrosse ball to come out of the bag and smash away at this area because there's a feeling of tightness there. And it's a bit misleading about what's causing that tightness, but I'm talking about the area behind the knee. So this area is quite an important area because it's a bit of a transition zone. You've got a number of tendons that come in from the thigh and then also up from the lower leg and kind of converge there, but then passing through that space that we call the popliteal fossa. We have nerves going through there, we have arteries, veins, and there's some lymphatic vessels as well. So there's a lot going on in there, and these are all pretty sensitive structures. And if you are taking this and smashing away at it because it feels tight, that can just be more damaging. Now, that feeling of tightness that you're getting there is not even related to that area, most likely. It's probably coming from higher up, and it's most likely to be involved with some sciatic nerve entrapment somewhere in that thigh and then up towards the hip, because the sciatic nerve originates in the lower back. It passes down through the glute and then down through the back of the leg and branches off as it goes, passes through the back of the knee, branching off down through the lower leg and into the foot. So it's continuous all the way through. And that back of the knee area down there is quite vulnerable because it's fairly superficial. But if you have an entrapment that's higher up, so there's, let's say there's some scar tissue that's tethered that nerve and it's not able to glide and slide as it should, then you're going to actually start to feel some symptoms further down from there, and that's often in that back of the knee area. One of the worst things that you can do is take this thing and start smashing it in there. Oh, and I've just dropped it. Because that's just going to irritate things that aren't really involved in the problem, and that's not great. So I think lacrosse balls can be handy for things like some maybe movement prep sometimes if you get to the gym, and some people like to sort of hop on that and use it in their warm-up and stuff. That can be a good thing. As I said, I think they're great for getting people to take an interest in looking after themselves, but it just doesn't replace hands-on, being able to feel what's happening, being able to functionally assess what's going on, and then start dialing into where the problem really is, and give it an appropriate treatment. That's what's really important here. So that's my little rant for today. If you're feeling some tightness in the back of the knee, put down the lacrosse ball, give it a rest, jump online, make a booking, come on in, and let's check it out. See you on the next one.